Good afternoon again. My name is Dr. Aminda Heckman-Chimanchek, and I would just like to welcome you to this webinar on mental health issues in LGBT populations. Before we get started, I just want to bring your attention to the first slide. For those people who are looking for continuing education credits, here are some of the things you have to do. You're going to log into the webinar system, create a profile, you're going to select today's webinar and pay the $15 processing fee. You're also going to take the knowledge test, and that should be available to you within this week. All of this will be in an email that you're going to receive within 24 hours of this webinar. If you have any questions, you can certainly send them to us. You can chat with us. There's going to be some contact information at the end. But we would like to, the Community Technical Assistance Center would really like to welcome you. We are so excited to have Gazelle Talawi with us today. Gazelle is a third-year doctoral student in the clinical psychology program at the University of Louisville. She conducts OCD and LGBT research at the Center for Mental Health Disparities with a specific emphasis on coping methods in LGBT individuals. She has published several manuscripts and book chapters, presented posters on OCD and issues affecting ethnic and sexual minorities. With that, I'm going to turn this over to Gazelle so she can get started on the presentation. And again, welcome to everybody.
All right, thank you so much, Aminda, for that introduction, and thank you to everyone who's here. As Aminda said, today I'll be talking about mental health issues in LGBT populations with specific focus on minority stress, a little bit about coming out process, and providing LGBT-sensitive therapy. So just to go over the learning objectives, what I want to do first is go over LGBT identity in a broad context so we all have an understanding of some of the definitions. I want to go over the mental health issues that face LGBT populations and kind of discuss why it's so important to have LGBT-specific treatments. I'd like to give an overview of minority stress theory and the role of minority stress in the context of LGBT mental health disparities, and then go over some treatment considerations and implications for LGBT individuals, as well as integration of this type of intervention. Okay, so this genderbread person is one really helpful visual for showing us how dimensional sexuality and gender identity are. In the past, we've typically thought of these variables as being dichotomous. However, we are moving towards viewing these constructs as existing on a continuum. So just to go over these continuums on the right side of this picture, gender identity is how you identify. So whether you view yourself as being man or a woman, somewhere in between, or neither. Gender expression is how one chooses to portray their gender. So this is through things like your behaviors, how you interact with people, your clothing, your hairstyle. Biological sex is the actual physical characteristics and genetic makeup. And then your sexual orientation is who you are attracted to physically, spiritually, emotionally, based on their sex or gender in relation to your own. So all of these variables are independent of each other. You can fall anywhere on either of these continuums, or you might not be on the continuum at all. Okay, so I really want to highlight the importance of mental health treatment for LGBT individuals by pointing out some of the unique issues they face. This first part is going to focus specifically on lesbian, gay, and bisexual mental health disparities, and then I'll go over transgender mental health issues a little bit later, as their difficulties are often heavier than LGBT individuals due to increased levels of stigma. So LGBT individuals face disproportionately higher rates of mental health disorders than their heterosexual counterparts, with 1.5 to 2 times more likelihood of reporting lifetime mood and anxiety disorders when compared to heterosexual individuals, and they also face significantly higher rates of trauma as a result of discrimination, interpersonal violence, and victimization as a result of their sexual orientation. Okay, so moving into the first polling question, which group has the highest rates of smoking? Do you all think it's bisexual individuals, gay men, or gay women? So smoking is something that is seen in increased rates in LGBT individuals, but one of these groups does have higher rates than the other. Let's give you all a couple seconds. Okay, so looking at the stats, bisexual men and women seem to have the highest rates of smoking of any subgroup for which data are available, with estimates ranging from about 30 to 40%. Substance use in general and other high-risk behaviors are also prevalent. For example, research shows that gay men use alcohol, illicit drugs, and tobacco at a higher rate than the general population. And gay women are also between 1.5 to 2 times more likely to smoke than heterosexual women, including both tobacco and marijuana. There are also higher rates of suicide attempts and completions among gay men and youth than other populations. And also, lesbian and bisexual women who are out are 2 to 2.5 times more likely to have experienced suicidal ideation compared to heterosexual women, while those who aren't out were more likely to have attempted suicide than heterosexual women. Okay, so I've covered a lot of findings, but I want to make sure I give some special consideration to bisexual individuals, as researchers have suggested that they have the lowest levels of emotional well-being among people of other sexual orientations. So bisexual individuals report higher levels of self-harm, thoughts of suicide, and suicide attempts than heterosexuals, gay men, and lesbians. And it's thought that this is due to unique experiences of stigma and stereotyping that are specific to their bisexual identity. And this includes being in the unfortunately unique position of confronting discrimination and exclusion from within the general community, so heterosexual individuals, but also discrimination from within the lesbian and gay community. And it's thought that this added burden, this kind of double discrimination, is what increases this likelihood of negative mental health consequences. Another polling question. So how many of you have ever worked with a client who identified as transgender? So there are a lot of barriers to treatment in transgender individuals, a lot of stigma. So I'm kind of curious to see if people actually have worked with transgender individuals. I'll just give you all some time just to make sure I get everyone's responses. There we go. So roughly half have worked with someone who identified as transgender, which is great. So I want to highlight how difficult it is to be a transgender individual in today's society, which is why I have their findings on their own slide. So roughly half of transgender men and women experience clinically significant depression and anxiety, which is compared to 9% of the general population when it comes to depression, and a very high estimate of 22% of the general population who experiences anxiety. Rates of PTSD are also much higher, with 18% experiencing clinically significant symptoms of PTSD, compared to, again, another high estimate of 5 to 10% of individuals who are not transgender. The most important of these stats are this last set of bullet points. This is the rate of suicide attempts, which is ridiculously high. So about 46% of transgender women and 42% of transgender men have attempted suicide. The rates among lesbian, gay, and bisexual individuals is about 10 to 20% and 4.6% in the general population. So that's 10 times lower than among transgender individuals. And then if you take nothing else away from this presentation, just note this last bullet point. So 60% of transgender individuals who have been refused treatment by a doctor or healthcare provider have attempted suicide. So this highlights how critical it is that we as healthcare professionals provide care to transgender individuals. They're in such need, and we are in the unique position of being able to help. Another big stat that's not listed on this slide is that roughly a third of transgender individuals have had to teach their healthcare provider about transgender health issues. So being here today and learning about this gives us a leg up and creates a unique situation where transgender individuals who see us are more likely to see someone who is culturally competent and sensitive. One way that we can be informed and provide adequate care to transgender individuals is to understand the current state of the diagnosis. So in the DSM-5, this was changed from gender identity disorder to gender dysphoria in order to reduce the stigmatizing effect of having such a label. And the change is meant to emphasize that the stress is related to gender incongruence rather than identity itself. So this means that it's not the identity that's the problem, but rather the incongruence between what is seen and what is experienced by the individual. And we might wonder why we even need such a term if it does carry the stigma with it, but it is necessary to provide protection in social, work, or legal areas, and also to make sure that transgender individuals can receive insurance coverage for medical procedures. So now I'd like to talk about one theory that explains why LGBT individuals have such high rates of mental health issues. So this theory is known as minority stress theory, which is proposed by Meyer. And it states that individuals who possess a minority status, such as being an ethnic minority or a gender or sexual minority, are more likely to have higher rates of mental and physical health issues due to increased stigma, prejudice, and discrimination, and how that creates potentially hostile and threatening social environment. Minority stressors are also chronic because they do reflect the stable and societal structures which are outside of the individual's control. They're also unique, which means that they're an added burden for minority individuals, in addition to the stress that everybody faces on a day-to-day basis from things like school, work, family, finances. And it's thought that it's this unique added burden that increases these rates of negative mental health outcomes. So when thinking about these unique stressors, minority stress theory discusses them in relation to their proximity to the individual. So those that are experienced outside of the individual are referred to as distal stressors. And these are things like prejudice-based events such as overt discrimination, anti-gay victimization, violence, or structural stigma. It's also seen in less overt things like microaggressions. Okay, so these stressors are a serious issue, with LGBT individuals twice as likely to experience a prejudice-driven life event, such as losing a job or some other type of workplace discrimination. And approximately a quarter of LGBT individuals experience criminal victimization, like physical or sexual assault, as a result of their sexual orientation. And then they also experience social exclusion. Then we move into proximal stressors. So these are internal, however, they are influenced and shaped by those distal stressors, and they include concealment of your identity, whether that's your sexual or gender identity, internalized homophobia or transphobia, and rejection sensitivity. So concealment is the hiding of one's sexual orientation or gender identity in order to avoid public stigma, ostracism, and rejection. The concern with this is that affiliation with individuals from one's own stigmatized group has a positive impact on one's self-perception, and concealment cuts off this affiliation, limiting access to LGBT support resources. However, it can be beneficial in the absence of social support and acceptance. So if a person is in a hostile environment or one in which they can expect to be rejected, it's helpful sometimes to conceal. The next proximal stressor is internalized homophobia or transphobia. So this is when you direct society's negative views about minority identity towards yourself. And this is something that can be a lifelong struggle, as even our clients who have accepted and are proud of their LGBT identities may still experience internalization of these negative messages. And then the final proximal stressor is known as rejection sensitivity. And this is characterized as anxious expectations of rejection based on one's stigmatized status. It typically originates from early experiences of rejection that comes from parents, peers, and other messages that they get from society. And so because of these messages, LGBT individuals may become hypervigilant in their interactions to avoid discrimination, which can then in turn lead to difficulties in interpersonal relationships and also maladaptive beliefs about what other people think about them. So just to touch on some of the negative mental health outcomes associated with these stressors, individuals who experience increased levels of distal stressors report more psychological distress, anxiety, depression, and substance use disorders. It's also associated with unassertiveness. And a lot of these responses are driven by avoidance because the individual isn't able to control when they experience discrimination. It's just this unexpected occurrence. Okay, proximal stressors are also associated with a whole host of negative outcomes. So these are things like anxiety, suicidal ideation, self-harm behaviors, eating disorders, HIV-related high-risk behaviors. And again, just like with distal stressors, a lot of these are avoidance behaviors that are used to distance oneself, at least temporarily, from the distress that's associated with the minority experience. Just to kind of put a visual to everything that I've just talked about, this is a model that describes the pathways through which these stressors impact negative mental health outcomes. A lot goes into this model, but it's really important for people in helping professions because it helps us pinpoint the spots at which we can intervene through treatment. And I'll go into this treatment a little bit more later. But as we can see, places that we can intervene through treatment are in this coping and social support area, and also in affirming LGBT identity, so those characteristics of minority identity in the bottom right. It's been shown that possessing a positive minority identity is associated with improved outcomes, and so I'll get into ways that we can affirm this identity. All right, so now I'm going to move into these treatment considerations. So, in general, when LGBT individuals are seeking out help, it's really important to consider the barriers that may have prevented them from treatment seeking and recognize that seeking out help is a really big step. Consider also their experience of coming out in a mental health setting. So these are private, sensitive disclosures that they may be discussing for the first time. And so in general, it's really important that we create a welcoming environment, which I'm going to discuss further in the next slide. Okay, so here are just some tips, some general guidelines for best practices in cultural sensitivity. First thing you want to do is make sure that you're mindful of your own stereotypes, assumptions, and biases. A lot of times we do make assumptions of sexual orientation or gender identity based on appearance. However, we have to know that sometimes gender, sexual orientation, self-identification, and behavior do not always align. So something that we think might be visible, might be clear, might not be what's actually experienced within our clients. So it's really important to get a feel for how they identify. The other thing we want to do is be aware of our clients' mistrust of mental health professionals and the subtle cues we may be sending. So we have to keep in mind that at one point, LGBT identity was seen as indicative of psychopathology. It was seen as a disease. Also, a lot of LGBT individuals have experienced losses in their lives, so lost relationships with friends, family members, or religious communities that have been cut off once they've disclosed their sexual or gender identity. As a result, a lot of our clients may be extremely aware and hypervigilant about cues we're sending, about whether or not we are supportive of them. So for this reason, there's a lot of things we can do to kind of present ourselves as friendly and supportive. One thing you can do is just have magazines in your waiting room that are directed towards LGBT individuals. You can also have one of these safe zone stickers that shows that you're an ally. A lot of universities provide safe zone trainings, so that's a good thing to have up to show that you are someone who is supportive. Okay. Another thing is to use inclusive language and know the terms. For example, it's important to ask for preferred gender pronouns. You can't assume that one's gender presentation aligns with their gender identity, because not everyone has necessarily transitioned, or not everyone is comfortable presenting how they would actually like to. Another thing is to not assume that everyone who's in a same-sex relationship identifies as gay. Some people might be in a same-sex relationship but identify as bisexual or pansexual or queer. So we want to make sure that we're getting the preferred terms of our clients. Another thing is to use open-ended language. So I think it's kind of reflex if you have a female client come in to ask about if she has a boyfriend or a husband, but using open-ended language like saying, do you have a partner, is something that shows that you are sensitive to their unique experience. And it's a simple shift, but it does show that you are accepting and acknowledge these issues. The next thing is to ask questions and welcome and normalize disclosures. So some of these topics are going to be uncomfortable, and our clients might not disclose them freely. So it's important that we do get at things like sexual history that might be uncomfortable. You also want to make sure that you're asking your clients to clarify any terms that you might be unfamiliar with. This is a way for you to show interest and also make sure that you're eliminating the chance of having a miscommunication or coming to conclusions that might not be accurate. The other thing is that just how do you respond if someone discloses their LGBT identity to you? It can be a difficult experience because you're not sure if the person is happy that they're disclosing to you or not. So something simple like, I'm glad you told me that, or that sounds difficult, how do you feel about it, can be something that lets you get a feel for where the client is at, and showing that you're comfortable and interested with their disclosure can really build rapport and show support. Also, not necessarily helpful to assume that every disclosure is something to be celebrated. Many LGBT individuals struggle with their identities, so if you are overexcited while they're still struggling with it, then you're not meeting them where they're at. The other thing is to avoid both over and under pathologizing. So given the mental health field's past tendency to view LGBT identity as a disease, some care providers might interpret any expression or exploration of sexual or gender identity as further evidence of mental illness. However, this exploration and expression of sexuality can really be a source of strength and resilience, and is something that deserves support from mental health professionals. The final thing is you want to be familiar with mental health referrals and resources. So you might need to help your client access LGBT-friendly healthcare. And so knowing these resources is going to be really helpful. Okay, so moving into some more specifics as far as treatment, it's going to be important that we reduce the impact of these minority stressors. So while not all of our LGBT clients come in with issues that are directly related to their sexual identity, minority stress has likely impacted their health in one way or another. So because of that, it's really important that we modify our standard treatments to be culturally sensitive to these unique and added experiences of stress and how they impact our client's symptom presentation. And because of this need to tailor current treatments, John Pachenkis, who's a prominent LGBT researcher, proposed a CBT-based LGBT affirming treatment, which is going to form the framework for the next several slides. I thought this was really important because it is the only intervention that's been specifically tailored to and empirically tested in sexual minorities. So while it was designed for gay and bisexual men, it should be applicable to other LGBT individuals as they face similar experiences of stigma. So this type of treatment basically has three functions. The first is to examine the associations between our clients' current behaviors and their learning histories and their experiences of minority stress across their lifespan. The second is to uncover unique strengths and sources of resilience within our clients. And the third aim of this type of treatment is to restructure the faulty cognitions that are related to proximal stressors that I discussed earlier. So when you get started, before you begin treatment, it's really important to understand the presenting issue that the client is facing through a culturally informed assessment. So this will be helpful in guiding treatment because you can determine your client's view toward their sexual identity and their gender identity and the experiences they've had that have shaped this. Some things to address are their psychosocial history, their stage of the coming out process, health behaviors, including any risky sexual behaviors, drug use, or physical health conditions. Also important to assess exposure to trauma, as this is present in increased rates in LGBT individuals. Also suicidality and exposure to distal and proximal stressors. The next part of this assessment is to get at the strengths. These are things like coping skills, social support, what the individual has in their corner that's protecting them from these negative outcomes. Social support is one really important one, and it's important to foster the growth of one's support system through therapy, which I'll get at in a little bit. So the experience of minority stress is a lifelong experience. It starts with messages from family members when you're really young, and then extends throughout life into things like discrimination in the workplace. Many LGBT individuals aren't even aware of the impact that this chronic exposure to minority stress has had on their identity development and mental health. So it's really important that we normalize the negative impact of minority stress and talk about things like depression and anxiety as being normal responses to this type of stressor. One technique that we can use here is psychoeducation, in which you discuss the fact that minority stress is a real experience that impacts mental health, maybe even showing the model and showing how this influences client symptom presentation. This is also where that minority stress assessment comes in, as the client is able to review their experiences and create links between how this has affected their mental health. And also increasing this awareness is helpful because it allows the client the space to shift the internalized negativity away from their identity and attribute it to an external source. And so knowing that there's an external source of distress allows the client to empower themselves against injustices at the personal and societal levels. So the second principle of this approach is restructuring the negative beliefs that LGBT individuals develop as a result of minority stressors. So as I mentioned, there's a lot of messages that LGBT individuals receive about their identities as being inherently flawed and in some ways less than the majority identities. And this results in things like anxiety, depression, internalized homophobia, or transphobia. And CBT can be really helpful in restructuring the negative beliefs and reducing some of the shame and increasing self-esteem that has been affected as a result of these messages. The third principle that we want to keep in mind is to encourage our clients to communicate assertively and openly. So experiences of discrimination send the message that the needs of our LGBT clients are not important, which can hinder their ability to be assertive in meeting their own needs. Thus, it's really important that we encourage emotional awareness so that the client is aware of what they need and then foster this ability to communicate openly and get the things that they need. So many techniques can be used to get at this. Let's say we have a client who's afraid to ask a boss for a raise or a promotion at work because of concerns about their own ability or about being discriminated against. You can use things like role plays to help with this, where you as the therapist can act as the boss and go through different possible scenarios of how the conversation might go. You could also use exposure exercises in which we gradually increase the client's comfort with being assertive and build up to whatever it is that they've been avoiding, such as asking for that raise or promotion. Assertiveness training in general is really important for LGBT individuals, given the increased rates of risky sexual and drug-related behaviors. So increasing assertiveness can be really helpful in allowing the client to decline substances or insist on the use of condoms and other safe sex practices. So, as I mentioned earlier, minority stressors are those that are unique to each minority population. So individuals in these minority groups have to develop unique coping skills and resilience in the face of these added stressors. This is why it's really important to highlight the client's strengths and the positives that come with possessing an LGBT identity. So these are things like being part of a community, not being tied to stereotypical gender norms, having opportunities to demonstrate your pride of your LGBT identity. And so these strengths are really helpful in dealing with the difficulties of possessing an LGBT identity in a less than accepting society, and really need to be encouraged in treatment. So one way to get at your client's strengths is to just openly ask them early in treatment as part of that minority stress assessment, that part 2 that I discussed earlier. And they can just openly discuss what they feel their strengths are that have helped them come through difficult times. Another way to identify an individual's unique strengths that they may not be aware of is to have them watch a video in which an LGBT individual discusses experiences of discrimination, and then have the client write their best advice on how to cope with those experiences as if speaking to the person in the video. So this type of exercise is useful in getting at these more latent sources of coping that the individual possesses that they may not even be aware of. The 5th principle is affirmation of rewarding and healthy sexual behaviors. LGBT individuals often learn that same-sex behaviors are shameful, and they may have difficulty engaging in intimate, loving relationships. Treatment is going to be helpful in terms of normalizing and reducing the stigma of same-sex behavior and reducing avoidance of healthy sexual relationships. This is done through cognitive restructuring that helps the individual view same-sex relationships as a source of pride. And if your client does value developing a romantic relationship but has had difficulty or has been avoiding, behavioral experiments can also be used to increase their exposure to this kind of thing. Another thing is just reinforcement. So if a client discloses a healthy relationship or being able to be intimate in ways that they haven't before, these are things that we need to reinforce in therapy. The final principle of this type of treatment approach is to promote the development of support networks. A lot of times our LGBT clients feel isolated. They're seen as being different from the majority group, whether that's based on their sexual orientation or their gender identity, and they lose friends and family support upon coming out. They may also have difficulty finding support within their own community, specifically when you think about the exclusion that bisexual individuals face. So they may not have a well-developed social support network. Given the importance of social support in buffering against negative mental health outcomes, treatment is going to be really helpful to encourage our clients to create these supportive, safe spaces where they can express their sexual and gender identities. This can be done through defining the client's value-driven behaviors and through behavioral experiments for clients who avoid certain situations, such as LGBT mixers, where they actually might access social support. Another thing is to connect your clients with the resources around them. So I have a transgender client who does not have any transgender friends, and one thing I did in treatment was find a support group. And now my client attends that support group monthly and has been able to get the opinions of other people who are at different stages of the transition process. Okay, so given everything I've discussed, should we always encourage our clients to come out? And I'm going to take a few seconds, get the answers to pop up. And just to give a little more background on this, when we are considering this treatment model, while it is helpful, it is applicable to a lot of clients, there are some variables that we do need to take into consideration that may influence how we apply these principles. And one of these things is going to be where the client is at in the coming out process. This is also going to include other things, which I will go into as soon as I see the answers to this polling question. There we go. So, majority of people think no. All right, so outness is just the degree to which an individual has disclosed their sexual orientation to the people in their life. And depending on different aspects, coming out may be a good decision for some and a bad decision for others. So people who said no were on the right track because some individuals may be in an environment where they may face violence or discrimination, or they might lose their social support. So in these situations, we want to make sure that we're not pushing our client to come out if it's unsafe for them. Also, some people might be out to certain groups in their lives, like their friends, but not their family, or their family, but not the workplace. So we need to be aware of different things that encourage outness, such as being in an urban environment, having social support, and having gay role models. And just in general, keep in mind where your client is at as far as their stage of outness, and not pressure them to be somewhere that they're not ready to be. So in working with individuals who are in the coming out process, so these are things to think of in addition to those principles that I've just discussed. The process of identity clarification is really confusing and anxiety-provoking, and it does vary so much across individuals. So taking on a client-centered approach is going to be really important here. It's also critical that we take on an affirmative stance. We might be the only people that our clients are out to, so it's really important that we're demonstrating positive regard towards our clients' identities. It's also important that we familiarize ourselves with models of sexual minority identity development and also gender identity development, which there isn't much research on. So two models that are really useful in conceptualizing sexual identity development are the CAS model, which kind of discusses coming out as this linear process, and person progresses through stages. And then there's also this multidimensional approach that talks about identity as having these negative and positive factors that can present in varying levels across the lifespan. And these two models, there's a slide on suggested readings at the end, and there are citations for articles that will cover each of these approaches. All right, so it's also really important to consider the fact that our clients are not just a sexual identity that's not attached to any other identity. So we need to understand the intersection of our clients' multiple identities, especially when they may be in conflict. So for example, some minority groups might have more negative views towards LGBT identities. So we need to keep in mind that difficulty, that added difficulty, when we're meeting with clients who possess a dual minority status. We also need to be aware of things like disability status, age, and socioeconomic status, and how those may impact our clients' identity development. Another big one is religion. So this is a variable that really can intersect with sexual identity and gender identity. The majority of clients who have tried or want to change their sexual orientation or gender identity have conservative religious beliefs that view LGBT identity as a negative thing. And so while religion may conflict with LGBT identities, a lot of our clients have placed value in their faith. So we don't want to just let them abandon this if this is something that can be a source of strength for them. So we want to keep in mind the positive impact that religion may have if this is an identity that's important to our client. So one way that we can do this is to encourage engagement with religious texts, which can help by decreasing the focus on negative writings about LGBT identity, and it can help identify core virtues that are consistent with one's religious identity and their LGBT identity. And for clients who miss having an affiliation with a religion, so for those who have distanced themselves from the religious community or have been shunned from their community, you can encourage them to seek out religious groups or places of worship that are affirming of LGBT identities. Many of these will be explicit in whether or not they're affirming, so you can help your client find these in whichever city that you're treating them in. Okay, so overall, it's really important to recognize that our clients each have a unique experience. So while these tips are important, it is going to be critical that you thoroughly assess and conceptualize each client's unique situation. So I am speaking about LGBT individuals broadly, but we can't assume that the experience is going to be the same. And like I said before, research into treatment for LGBT individuals is extremely limited, so this is just going to be one framework. So it's critical that as people who are planning on treating LGBT individuals, we remain informed and open and curious when working with this population. For this reason, I have included a resource list and suggested readings at the end of this presentation, which you should have access to. All right, and now we have some time for questions, and then after that I can show you all the resource list and suggested readings.
All right, thank you so much, Gazelle. So what we're going to do is I think some people have submitted some questions along the way, but now is the time also to send in your questions. I'm going to start off with this first question, which is, Gazelle, how do you suggest finding resources or support groups for LGBT populations and local communities?
That's a really good question. So that's, with my transgender client that I referenced, one thing you can do is just Google. A lot of times you might have to find, if a client is in a smaller city, a smaller town, you may have to find resources that are sometimes 45 minutes away to an hour away, but there are online resources that will list LGBT-friendly healthcare providers, and a lot of times it'll be trial and error. You might access a resource list and find that some people have removed themselves. But the resource list that is at the end of this presentation does have national hotlines that people can call into if they need to, and those can be accessed from anywhere. There's a transgender-specific hotline that's staffed completely by transgender individuals targeting youth. So yeah, there are a lot of resources. If you look on the APA website for LGBT-sensitive therapy, and also this resource list should be really helpful.
Great. The next question is, what factors should we look for in a client's social support to determine how safe it is for them to begin the coming out process?
Well, that's, we can go into a lot of things here. So one thing you can look at is whether anyone in their family has come out and the level of support that they have received, if they have any LGBT role models around them that would make it safer for them to do so. You want to know about the environment of whichever city they're in. So how is the LGBT community in their particular area? Is their place of worship affirming? Do they have friends that have discussed these topics? I'm going to switch over to the resource slide just so we can look at this. But yeah, just to you know, have people engage their friends and gauge how they stand on these topics.
Great. Okay. The next question says, you mentioned that some people may be out to various groups within their networks, for example, out to friends but not out to family or coworkers. This person says, my clients often describe coming out as a recurring trauma. How would you recommend talking through coming out to various groups?
Well, I think that's gonna vary. If it's an environment where they don't feel like it's safe or they don't feel like it's the best to come out, then maybe it's best. But it is a repetitive trauma. It's something that comes with possessing a hidden minority status. That can be difficult. One thing that you can do is ask why it has been a traumatizing experience to come out. How have they experienced coming out in other groups? But you know, it's one of those questions that really just depends. Even at work, there might be one person that you feel comfortable coming out to, and not the entire community. So yes, it's just important to recognize that all groups aren't going to have the same response to your client's disclosure of coming out, but it really will be person-specific and environment-specific. I know that's not a very clear answer.
Okay. The next question is, how do you recommend advocating for LGBT-sensitive waiting rooms or intake forms in an agency?
That's a really good question. A lot of times it's really hard to change existing policies. So if you're working within an agency that uses forms that you feel like might be insensitive, one thing to do could be to go to whoever is in charge of these things with suggestions for improvement. So you can access demographic forms online that are going to be LGBT sensitive and present these as potential solutions instead of just saying, oh, I think the way we're doing things is not friendly. Another thing is to see if it's okay to have safe zone training stickers or have LGBT-friendly magazines in the waiting room. The safe zone is something you do need to be trained in, but it is a sticker that has a lot of weight. And another thing you can do is to include, just make minor changes to the demographic forms. So include a larger list of gender pronouns, or ask about specific sexual orientations. Also ask open-ended questions about relationship status. But the way I've understood the question is, if you are in an agency that doesn't necessarily do these things already, how you can make those changes. But it will be just presenting your concerns with potential solutions, I think would be the best way.
Okay. Can you talk about how the coming out process might look in different stages of life? For example, is it a lot different when the coming out process is happening for an adolescent versus a senior citizen?
Yes, the coming out process is going to vary. People who came out, people who are older and came out earlier are going to have very different experiences. So, things have become more accepting recently. So people who have had to come out in times where it wasn't will say things like, oh, things have changed so much since I came out, or people these days have it so much easier as far as coming out. So people who are older really will have a different view of coming out. They may not be as open, they may have more internalized homophobia, more experiences of discrimination, and will accept that that's just part of the process because it was when they were younger. And so we can't assume that they're going to be as comfortable as our adolescent clients because things are shifting, things are becoming more accepting. Adolescent clients are likely to have an easier process coming out. However, it also is going to be environmentally specific. So if a person is coming out in a very liberal part of town, they're going to have an easier time than an adolescent who's coming out somewhere that's less than accepting. Also, I think society is moving towards this more fluidity, and so it is just a more accepting time to be coming out, and it's also going to vary by gender. So it's thought that women have more freedom as far as how fluid they are with their gender and sexual expression, and that's something that's going to be easier for younger women coming out than women who have had to come out later in life. And it's also going to vary if your client is transgender. Like, that might still be something that's really hard to do, even if they are younger, because transgender issues aren't at the same level of LGB individuals, and they're still more discriminated against. So I guess the short answer is that our younger clients are going to have an easier time with the coming out process, but it really is going to vary on their environment.
Okay, there seems to be a series of questions here, Gazelle, that have a common theme. So I'm just going to summarize and make up kind of a question here, because a lot of the participants are asking about clients' reluctance to reach out for services or to connect with the LGBT community. One particular question asked about helping a transgender client connect to support when the client's internalized homophobia and transphobia interfere with their willingness to connect. Other ones talk, it's basically the same thing, like how do you recommend therapists help the clients engage with services when they're reluctant, whether it's because of the internalized homophobia, transphobia? Tell us a little bit about that.
Okay, so one thing that would be really important is to assess why they are having such difficulty with this. Are they expecting to be discriminated against? Are they thinking that they might be rejected by the trans community because they haven't transitioned or because they're at a different stage of development of their identity? So it really is important to get a feel for exactly why they are struggling so much with accepting reaching out. The other thing you want to do is kind of stress the importance of social support. There's a lot of research that shows that social support is really good in protecting against these negative health outcomes. So just providing some psychoeducation, normalizing the fact that it is hard to reach out for all these reasons, but also normalizing the experience of essentially losing people during the coming out process and needing to create this kind of replacement family. And, you know, just kind of, this is, I think, what I was talking about with exposures and behavioral experiments, increasing their exposure to these things gradually. So you might want to just say, you need to go to a support group right away. That might be too much, so maybe starting with like an online support group and easing them into things that way. But it's just one of those things where you have to meet your client where they're at, do your best to inform them of the benefits of seeking out social support and some of the costs of not having social support, and then, you know, helping them work through their internalized homophobia and transphobia with some of that cognitive restructuring that I was talking about. And if you're working with adolescent individuals, it can be helpful to look up parent organizations that can help guide their children in accessing resources and that kind of thing. So yeah, it's kind of a multi-step process that begins with really understanding why the difficulty is there. But that's a really good chain of questions.
Excellent. So it looks like we are just about out of time, and I want to take this time to first remind everybody, if you are interested in getting CEUs, the very last slide, if someone could go forward to that slide, that would be great. As a reminder again of what you need to do to get your CEUs. You're going to get an email within 24 hours also summarizing this, but it is important to go ahead and take that knowledge test or you're not going to be able to get the CEUs. Also, I want to give a really warm thank you to Gazelle Talawi from the University of Louisville. She did an excellent job, and we're just here at CTAC, we're just so happy and so privileged to have you come and speak with us today. If you have any questions, there is a slide also where you can email CTAC, so you can ask any questions there, or if there's more information that you need, especially about CEUs, I do encourage you to email us. Is there anything else that you wanted to say, Gazelle, before we log off?
I just want to say thank you so much to everyone for being here, and I really hope that this helps provide, more culturally competent care to more LGBT individuals. Perfect.
So everybody, I hope you have a wonderful weekend. And again, I encourage you, if you have any questions, especially about CEUs, at this point it's more helpful to email than it is to put in the chat so you can make sure that your question gets answered. Okay, so thank you everybody and have a wonderful weekend.
Thank you so much.